Good morning. This is Dr. Susan Love from the Dr. Susan Love Research Foundation and the Army of Women. Welcome and bienvenida to our first Army of Women webinar. I'm very excited. I've been wanting to do this for a year and nagging my staff about getting these webinars up and running. We want to close the loop. All of you are participating in the studies, which has been wonderful, and we owe it to you to give you results and what's come out of them. So this is our inaugural event, and we look forward to getting your feedback so we can make it better, because I'm hoping these will be regular events. Today, we have Kristi Graves. Dr. Graves received her PhD in clinical psychology from the Virginia Polytech Institute and State University, and her postdoc training at the University of Kentucky College of Medicine. She's coming to us from Washington, D.C., where she's the assistant professor of oncology in the Cancer Control Program at the Lombardi Comprehensive Cancer Center in Georgetown. Her specialty or her interest is particularly factors that influence the quality of life in cancer survivors. And she also conducts research on expressive writing with cancer patients and psychosocial and behavioral outcomes following education about genetic risk for cancer. This particular study was focused on Latina breast cancer survivors and their quality of life. And she had already started it, and certainly she designed it prior to the Army of Women coming into being. But we were able to help her complete her recruitment, and are very excited that with some of the results she's obtained and with the fact that it's been so successful. So with that, I want to tell you one thing. If you want to ask a question of Dr. Graves, whenever it occurs to you, then just type it in and on the screen, and we'll be able to see it. And then at the end, I'll be asking her questions, and we'll get your question answered. So with no further ado, I'm going to hand the webinar over to Dr. Graves, who will give us the presentation.
Very much, Dr. Love. I'm delighted to be here today and share some of our results with Army of Women participants, so thank you for the invitation. And I will be talking to you today about our study where we looked at quality of life in Latina breast cancer survivors. I'd like to begin with an overview of what was the purpose of our study. We wanted to look at what types of factors, what things in women's lives might be relevant to the survivorship experience for women who are Latinas and have been diagnosed with breast cancer. What made their quality of life better or worse? And so I'd like to start the presentation with a brief definition of what quality of life is. It's a subjective experience. It's how somebody feels about their own well-being. And so in some of the research literature, quality of life is defined as what we call multidimensional factor, and it includes lots of different things: how you're feeling physically, how you're feeling emotionally, how you're doing socially, functional domains, which might include, are you able to get around like you want to, get to work, get home from work, go to the grocery store, those types of things. And so we wanted to know what unique factors might contribute to the quality of life and help improve survivorship experiences in Latina women. And so why were we interested in looking specifically at Latina breast cancer survivors? As you all likely know, the growth of the Latino population in the United States is increasing very rapidly. And luckily, more and more Latina women are making sure that they get screened for breast cancer through mammography. And hence, if a breast cancer diagnosis is found, it can be found a little bit earlier, and that leads to greater survival if a woman is diagnosed with breast cancer. And so the overall number of Latina breast cancer survivors will increase with the increasing population and with earlier detection. And so we wanted to look at this unique group to see what factors might impact quality of life in Latina breast cancer survivors. There's been a lot of work done with breast cancer survivors in general, but we thought, there may be some unique factors for Latina women, maybe related to women who are immigrants to the United States. Language, there's something called acculturation, which relates to speaking the language and acculturating into new society. Social factors, access to medical information, communication with doctors, all of those types of things. So let me tell you a little bit about what we did. We had two main phases of this research. In phase one, we talked to Latina breast cancer survivors to get their points of view. We asked them to tell us, both in individual interviews that we conducted with about 25 Latina breast cancer survivors, what is your quality of life? Tell us your story. Tell us about your cancer diagnosis experience, your treatment experience, and really focus on what's going on in your life now as a survivor, what factors impact your overall well-being, and how do you define quality of life. Then from the information we gathered from those interviews, we conducted two focus groups, small group discussions with about 5 women in each group, going over some of the factors that we were learning after we talked to the women. For the women in the small group discussion, do these things make sense? What impacts your quality of life? And they shared their experiences with one another and then with us as the facilitators. From phase one, we then made sure in our survey that we wanted to do, we were covering all the different types of topics that the women had told us were important for their quality of life. And so once we had our survey, we did a pilot test of the survey. We tested it out with 10 additional Latina breast cancer survivors, got their input. Were the questions easy to understand? Did they make sense? Some of the questions that we were asking hadn't been fully translated into Spanish in the examples of the survey questions, so we tested out our translation. Does this translation mean what we think it means? So that's our survey testing. Once we had our final survey, we recruited 270 Latina breast cancer survivors to do the survey, and the cross-sectional point here on the slide indicates that it was a one-time survey. The survey lasted about 45 to 60 minutes, and as Dr. Love had mentioned, we collaborated for our recruitment with the Army of Women. So let me tell you who could participate. Any woman who self-identified as Latina or Hispanic, and women who had been diagnosed not earlier than 1 year. We didn't want women who were in active treatment, who were still going through chemotherapy or recovering from their surgery. So we wanted them to be at least 1 year away in time from when they were diagnosed, but less than 5 years away from their diagnosis, so that some of the experiences in their survivorship outcomes, physical health, emotional health, they weren't too far away from their diagnosis. Women needed to be living in the United States at the time that they were diagnosed, because we were particularly interested in, are there factors within the medical system, the U.S. medical system, that might impact quality of life in survivors. Women could be English or Spanish speaking, and they needed to be older than 21 years of age. So how did we find women to do our survey? We did a lot of different things. We started locally in the D.C. area to reach out to organizations that we've worked with, research groups, community clinics, specific physicians that we've worked with. And we did get a lot of women from our local recruitment efforts, but then we needed to open it up nationwide so we could increase the number of women who completed our survey. We partnered with academic medical centers, community agencies. We did some e-blasts over internet-based networking and program sites, and identified specific support groups and advocacy groups across the country. The woman featured in the picture here, that's Dr. Janet Kanar. She was the research coordinator for this project, and so she conducted almost all of the interviews. So if you were a participant in our study, Janet is who you spoke with. And then finally, our largest and most helpful collaborator in terms of helping us identify Latina survivors was the Army of Women. So this chart here highlights where the specific women came from in terms of our recruitment source. And as you can see, just about a third of our sample came from the Army of Women. And we had been working really hard and expending lots of energy trying to find Latina breast cancer survivors to complete our survey. And then when we partnered with the Army of Women, it just made a huge difference. And women stepped forward very readily and very easily, and they were great to work with. So who were our participants? Let me tell you a little bit about the characteristics of the women who completed our survey. Women were, on average, 50 years old, as young as 28 and up to 88 years old. Women had been diagnosed about 3 years earlier, and the range, of course, was 1 to 5 because that was the eligibility criteria for our survey. And in terms of how much education or schooling women had received, they received, on average, across the whole sample, some college education, so up to 13 years with a wide range again. Some women reporting no formal schooling, and some women reporting up to 19 years of education. In terms of the stage of diagnosis for the women in our survey, most women, you can see, were diagnosed at either stage 1 or stage 2, so earlier stages of diagnosis. But we did have women, some who were diagnosed with stage 0 breast cancer and all the way up to stage 4. About 1/3 of the women asked to complete the survey in English, and 2/3 asked to complete the survey in Spanish. And of our sample, which I'll describe more in terms of countries where women came from, about 40% were born in the United States. And you can see here, first, second, and third generation. That refers to which generation in their family they were if they had been born here, with about half of them being the first generation born here. So women came from all over in terms of being from Central or South America. You can see the different countries represented on this slide. And so what did we find? This slide goes over the specific factors that we found that were related to quality of life. And let me take you through these things. And I'll describe each in turn. First, social support, a factor we called social constraints, cancer fatalism, and language. So starting at the top, social support. That refers to women's sense in their own lives of how much support they receive from their family, from their friends, from their coworkers, anyone in their life, and the general sense of, I feel supported. Women who reported feeling more supported had better quality of life. Social constraints is somewhat related to social support, but kind of in the opposite direction. So social constraints refers to if a woman has an environment for those who are closest to her, we ask women to think about the person who was most important to them and whether that person allowed them to talk about their thoughts and feelings of breast cancer. So for women who said, no, I don't feel comfortable, I don't feel like I can share my thoughts and feelings about breast cancer with the person who is closest to me, those women reported less quality of life. So that means if you're in a situation, if the person who you say is closest to you, whether that be a partner or a child or a friend or a family member, whoever you label as closest to you, if you don't feel like you can share your innermost thoughts and feelings about breast cancer, you also reported less quality of life. The next one, cancer fatalism, refers to thoughts that if you get diagnosed with cancer, it's kind of like getting a death sentence. Women in our study who were less likely to think that way, they did not think that if you get diagnosed with cancer, it's an automatic death sentence. They were more optimistic about what might happen with their cancer and treatment. Women who were less fatalistic about their cancer reported higher quality of life, better functioning. And then finally, the last factor that we found related to quality of life was the language that women completed the survey in. And I'd be interested to hear people's thoughts about this. So women who completed the survey in English reported slightly higher quality of life than women who completed the survey in Spanish. This might be related to ease of access and getting medical information, ability to communicate with physicians, a number of different things, maybe comfort in understanding information provided to you about treatment and what happens next after you end treatment, but language was related to quality of life. So I'd like to pull out a few specific things. At the end of the survey, we asked women if they had any other comments for us or any other things that they would like us to know. And several of the things that women told us relate directly to what we found when we looked at the survey responses itself. So I'd like to go through some of those. So as related to social support, one woman told us that the problem here is that support groups are very few. She was speaking of in her hometown. Most of those groups are conducted not in Spanish, just in English. They don't meet very often, and the places where the support groups are held are very far away, and all of these factors are not friendly for the Latinas. So that was one woman's experience as related to support groups in her area. Ideas that women shared with us that were related to our findings of cancer fatalism and quality of life. One woman said, women need to have education or information about what causes the disease, causes breast cancer, so they don't think that they will die if they get diagnosed. They need to learn how to prevent the cancer, and it's not about speaking English because there's help and information in Spanish too. That was one woman's point of view. Another woman said, one should learn to fight with this disease and don't give up on life. Continue taking care of your health and informing yourself. We did have a number of participants who talked to us about communicating with physicians and what that was like for them, and that may or may not relate to our finding related to language and quality of life, but I just wanted to share a few of these. One woman said, it's very important that the doctor or health provider, the ones who give us the diagnosis, should be more positive and culturally sensitive when they say the diagnosis to women, when they tell a woman she's been diagnosed with breast cancer. Another woman said, doctors have to learn to communicate better about breast cancer with Latina women. On the one hand, Latina women don't ask enough either because they don't know what to ask them, or because some Latina women think that doctors are God and they will never go to get another opinion. So those were two women's perspectives from our participants who did the survey on communicating with their physicians. So what do our results mean? One thing that came out clearly with both the social support and the social constraints is that the social environment may be a significant factor in Latina survivors' well-being. And women who feel supported and those who feel that they can share their feelings about their illness with the people who are closest to them seem to do better. Fatalistic thoughts, the idea that if you get cancer, it's a death sentence, impact overall well-being. And one thing I'd like to point out is we did include information about women's stage of disease when we were looking at what impacted quality of life. And stage of disease did not predict quality of life, which was a little bit surprising to me. But the way women thought about their disease did impact quality of life. So that's something that we can look to in the future, which I'll describe next. And then language preference, as I've talked about, may be related to ease of communicating with physicians, understanding of treatment information, and those types of things. So what might be the next steps? My thoughts, based on the information we got from our survey, as well as some of the other research literature out there, is to make sure that we can identify women and Latina survivors who may feel that their environments are not as supportive. If we can find those women, then we can then provide specific programs, emotional support, practical support, identifying those women who might be in most need. And then looking to provide clear explanations of information about cancer staging, treatment options, and making sure that, if someone does receive a cancer diagnosis, they know that it's not an automatic death sentence in most cases. That there is a lot of information that they can get about treatment options, where they are, what they can do, and different revenues and avenues for gaining resources and support. And then I'd just like to highlight 2 existing programs that are being studied. One is called Nouveau Emancier, and it's an intervention to improve quality of life for newly diagnosed Latina breast cancer survivors. And this intervention program is being tested in California. And I serve as a consultant on this project. And Dr. Anna Napolies, who's at the University of California, San Francisco, is leading this project in collaboration with Circulo de Vida. And they have a community-based participatory research program. And they are working to adapt an intervention that I had developed, a coping skills program, make it culturally sensitive, and have it implemented for newly diagnosed Latina breast cancer survivors. They want to provide support, provide education, and increase coping and communication skills with, and these programs are led by Latina breast cancer survivors themselves. So they train the survivors, and then these survivors go out and provide the program to other women. One other program that's underway is a patient navigation program through the Latina Share program in New York City. They have patient survivors who serve as navigators to women, and they provide support, resources, interpretation services, and help women through the process from screening all the way through survivorship. So that's an exciting program that's going on. I'd like to extend my heartfelt thanks to all of the Latina survivors who shared at least an hour, if not more, of their time and shared a lot of their experiences. And we asked some personal questions of them, and everyone was so gracious. So I just want to say thank you to the survivors who gave us all of their time and information and support. And also to thank my collaborators, and they are all listed here. It's a group effort when you do a project like this, so I'm very pleased to have been involved, and I'm grateful to all of the people who supported us in our efforts.
Thank you, Kristi. That was really great. One of the things as a surgeon, I must admit, have often poo-pooed some of this quality of life research, but there now is some pretty good biological data that if you have social support and improve your quality of life, you actually have less recurrences and survive better. So I think that even though it's sometimes thought of as soft science, it may be a lot more important than we in the medical profession have given credit to.
Right. The evidence is emerging that both quality of life and other types of what we call patient-reported outcomes, the way people view their illness and what's going on with them and their perceptions of how they're doing, can be related to other, maybe quote-unquote more, hard outcomes like survival and those types of things. So how someone feels and what's going on with them socially, emotionally, functionally, does have an impact on their overall well-being and maybe even their overall health status.
We have, if you want to ask a question, you can type it into the screen, and we'll see it here, and we will ask it. We have one question from Rebecca Hernandez that most Hispanics are extremely proud people, and it's hard for most of us to talk to anyone in support groups. How can we be helped, or how can we change that? I don't know if you have any insights into that, Kristi. One thought that I have certainly is if you go through institutions that are already comfortable for them, like churches, it might be easier.
Mm-hmm. Mm-hmm. Here in Washington, D.C., we have a program called Nueva Vida, and they offer a range of different services. And support groups aren't for everyone. If you want additional support, there may be other options like talking one-on-one with another woman who's been diagnosed, another Latina woman who's been diagnosed with breast cancer. It might be a little bit easier to share with just one person what you're going through and, not share with a whole group of people. And so looking to see if there's, other avenues of getting support, even talking to friends. They may not, if they haven't been diagnosed themselves, they may not know exactly what you're going through, but having a safe place where you can share. There are online groups available. I'm not sure if there's online groups conducted solely in Spanish, but it's something I could look into also. So I think there's a few different ways, and support groups aren't for everyone, and that's okay.
Yeah, some people do better. I know there's also a group in Texas that one of my former patients is very involved in, called the Promotores, who both help promote screening but also provide navigators and support groups. And so I think in a lot of areas where there's a higher Hispanic population, if you look, you can find both Spanish and English support groups and people who will reach out.
Right. The program that I mentioned in New York City, the Latina Share, they have a website that's in English and Spanish. If you type into Google Latina Share, it should come up. The website is sharecancersupport.org. And I know that they have some hotlines available. They may not have specific programs for women outside of the New York City area, but they do have telephone numbers provided on the website. So that could be one option.
And the Why Me has a 24-hour hotline, and they have all languages, including Spanish, on that. Mm-hmm. So people who have questions, they have trained people who answer them, and that's another resource wherever you are, anytime, day or night. I think they even have one for men, spouses, and if they have questions that they don't want to bother their wife with, mm-hmm. sort of, that they want to go separately. So that's another possibility.
And the American Cancer Society has a similar information line, I think, so they may be able to identify support services in your location.
I know you said this, but we have a question about it, and it may be worth repeating. Where Nuevo Amanecer is
mm-hmm.
Being studied in California.
That's in the area surrounding San Francisco. And if someone has a specific question about that study, they can email me. My email is on the screen now. And then I'd be happy to direct them to the women and the community agencies that are doing that study.
Kathy Wichterman asked what the next steps are based on the results of this study. What are you going to be doing next?
Well, I hope to continue my collaboration with Dr. Napolies for the program that we just mentioned. So she's testing out the coping skills intervention, and then from there, if it looks like it's working and effective in improving quality of life and reducing anxiety and reducing depression, then we can look at taking that model and applying it to other areas and other Latina survivors across the country.
Were you surprised by any of the study results?
I think the main thing that I was surprised about was that women's stage of disease did not relate to quality of life. When we had included the social support and the social constraints, in statistics you can look at different variables at different stages. And so at first when we looked at things, stage of disease was related to quality of life. But then when we included information about how women felt about their social support and the social constraints, stage of disease did not remain as a predictor of quality of life. Now, I do want to point out that some of the women we spoke to in our study were not 100% sure about what stage they had been diagnosed with. And so future work, one other avenue I would like to look at is getting more specific and maybe information from women's medical charts so we can accurately document the stage of breast cancer when it was diagnosed, and then include that to look at that as a predictor or look at if it's related to quality of life.
We have a question about that we've actually had a couple of questions that have to do really with financial issues. And the question is, how did you look at all about how that interacts with quality of life? I would think whether you have insurance or whether you have the means to pay for your treatment might be a major factor.
Right. We asked women if they were insured, and about 12% of our sample did not have insurance. So most of the women we talked to did have insurance. It did not relate directly to quality of life in our sample. It could be that if we look at, kind of break up the women in our survey a little bit more, we might find some differences, but in the overall sample, having insurance or not having insurance, interestingly, was not related to quality.
So it seems to be more than whether you're going to die, i.e. whether you have an advanced stage of disease. What's more important in your quality of life is whether you think you're going to die. So, in other words, you might have good cancer that's not going to kill you, but if you think you're going to die, you actually have a worse quality of life than the person who is optimistic with metastatic disease.
Right, and that makes sense in terms of some other research and psychology and the history of, how what people think affects how they feel. So if you have a lot of negative thoughts in your head, then you're going to feel worse. You're going to feel a little bit more depressed or distressed than if you have more positive thoughts. And there's that fine line. You can't make something. You can't change your stage of disease by having positive thoughts. So it's something about the way you perceive your situation, what you think, and then what you think you can do about it, and reaching out and making those connections that work for you.
We have a couple of questions about lymphedema and side effects of treatment, and I'm wondering if I don't remember you mentioning this, I might have missed it, but whether the consequences of treatment for cancer sometimes can be affecting your quality of life, whether it's lymphedema or chronic pain or problems from chemotherapy. And did you go into that at all?
We did ask women about some of their side effects. We had a question about lymphedema, and we asked about cognitive impairment, chemo brain, as well as fatigue. And we're still looking at some of that information because it can get a little complicated with the way women answer and creating different levels, like high fatigue or low fatigue. So for our study, we're still looking at that. But in other studies with breast cancer survivors, those things can be directly related to quality of life. And there's been some research that Latina women may report higher levels of some of those things, greater impact in terms of fatigue or pain. And, the researchers are still looking at that. What might be driving those things for Latina women? Is it the stage of illness that's related, the care that they receive? It's, some women may get, if you can speak easily to your physician, maybe your side effects and the treatment outcomes are more easily addressed than if you have to wait for an interpreter or things don't get translated clearly for you. So I think some of that is still up in the air, but overall in breast cancer survivors, physical side effects like fatigue and lymphedema do impact different types of areas of quality of life.
We have a couple questions from about, and one of them about whether women who weren't born in the U.S. are afraid to come forward because they're of fear of being deported.
We were very careful to let women know who had indicated any interest in this survey that we didn't care whether they were here legally or illegally, but that we don't know if women didn't volunteer for our study if there was a whole group of women who didn't volunteer because they were afraid of that, we don't know that information. So that's something to think about. But given that we didn't ask anything about legal status at all.
So don't ask, don't tell.
Right. But
do you think they also might have fear about going to the doctor for that reason? Do you know of any literature on that?
I don't know specific studies off the top of my head, but we've had, anecdotally, both in this study and some other studies conducted here, women have reached out to say, I don't have insurance, I'm not here legally, I think I have a breast lump, or something was found on a free mammovan screening or something like that. Where can I go? And so in some areas surrounding Washington, D.C., there's some support networks. We have Spanish Catholic charities here in this area. So there are some agencies, at least that I know, in the D.C. region, and there may be in other metropolitan areas, where women can go for help with paying for treatment, regardless of their legal status and regardless of their insurance status.
A question about whether diet has anything to do with Latina women getting breast cancer. I don't know if you want to address this, or I can make some comments as well.
I'll defer to you first.
I mean, the studies on diet actually have not shown any specific food that if you just eat this, you'll be okay. There has been some suggestion. I mean, breast cancer actually is less common in Latina women than in Caucasian women, and there is some suggestion that chilies may reduce breast cancer risk, and that if you have food that is more picante, that you may have less breast cancer. This is the idea that I stick to since I really like my chili. But there really hasn't been specific food. The key seemed to be, especially for postmenopausal breast cancer, weight and exercise. So it's more important that you're not overweight postmenopausally than what exactly you eat. And exercise also seems to be really important, both at preventing breast cancer in the first place and at reducing recurrence. So I think those are two areas. Now, often, particularly Latina women who are newly in this country are working at much more physical labor, and so that may be another reason why they have lower risk in general of getting breast cancer. Another question was whether these results will be published anywhere.
Yes, we hope so. We are still finalizing all of the data analysis, and in fact we have a meeting next week to take it to the next step and try to work for writing up the paper and then sending it out. Some of our earlier work with the focus groups is under review for publication.
Great. When it comes out, please let us know, and we'll put a PDF up on the Army of Women website so women can actually look at the paper if they want.
Terrific.
Here's another about how can we reach out to other Latina women to spread the word if they're not on Facebook, Twitter, etc. One of the things we're trying to do with the Army of Women right now, we're writing a grant to fund it, but is to be able to do it through cell phones, and smart cell phones. It turns out that the Latina population is the largest user of smartphones in the country, and probably many of them don't have computers at home, but so they do it all on their smartphones. But either on cell phones or smartphones, we're hoping to be able to use that to get the word out about these things, about the Army of Women, and to increase our involvement of the Latina population in our studies, because we really would like to have more Latinas. If we don't have everybody representing the whole population in the Army of Women, then the research is not going to represent everybody, and will only represent the people who sign up. So it behooves all of us to reach out to 5 or 6 friends to to get more people on, and that way we'll get more research that represents all of us. So that's a good question. And there's another comment about filming PSAs targeting Latina women in Miami, Texas, New York, and California in both languages. That's a good idea. We do have PSAs, but not in Spanish. And another thing I'm trying to do is get my book in Spanish. Believe it or not, I can't get publishers to agree to translate it. The Spanish publishers all say our women don't want to know all this information. And we're thinking about, in fact, translating chapters and selling them online so that it'll be more accessible to Latina women all over the world, and get more information out in an easy way. So that's a question. Another question that's coming up is how women, Latina women, and you may have some insight into this, Kristi, get information about their options. Options like reconstruction, physical therapy after surgery, whether they have mastectomies or breast conservation. Do you think that there are enough resources out there that are done in a way that really is accessible to the Latina population to have them recognize their options, or what can we do to improve that?
I think that it's hard for anyone right at the time of diagnosis to know exactly where to go and understand, and then if you have a language barrier on top of that, it can be even more complicated. And I think some of the programs we've highlighted and mentioned during the call today, I think there are some existing and specific resources for Latina survivors, and so maybe starting with some of those places and seeing, if they have literature available. The American Cancer Society, I believe, has a lot of their information in Spanish already, and so reaching out to some of the existing places and then seeing, does any of this apply to me? Does it make sense to me? And I encourage women to ask their physicians, I need this information, where can I get it, and where can I get it in a way that makes sense to me and that I can understand. And with women being active and involved in their care, then hopefully their physicians, if they're not already, they'll realize, okay, I need to make sure I provide this to all of the patients who come to me, so that there can be a slow shift in the way things are done.
One of the things I always encourage women to do who are newly diagnosed, and I think it might be particularly beneficial to women who are not as comfortable with the language, is to bring a tape recorder to every important doctor's meeting. Mm-hmm. Because that way you can listen. You're so nervous when you're sitting there that you only hear half of it, and if you have a tape you can listen to when you're comfortable at home, you can sometimes, it's not that the doctor isn't saying the things, it's that you're not hearing them. And it also makes you more comfortable in the doctor's office because you relax a little bit, since you don't have to, catch every word. You can listen to it again later. So,
right.
There is some data that people do better, and bring a friend to take notes as one
right.
of our suggestors. I agree about the friend to take notes, but the problem with that, I find, is that if the doctor uses a word that the friend can't spell, she gets stuck and misses the next 4 sentences. So the tape recorder, gets you around that. So I think both. But what I like for the friend, I say bring your most obnoxious friend. The one who will ask the questions that you don't want to ask because you don't want to insult the doctor. And so you could just pretend it was the only, ride you could get. But if you bring somebody else who and review with them ahead of time, these are the questions I want to get answered, then they could be the bad guy, you could be the good guy, and you still get your questions answered. So, because it's hard for women. We all become good little girls when we go to the doctor, and we don't want to make the doctor mad at us. and even I do when I'm a patient. So so there you have to use tricks sometimes to help yourself, and the tape recorder and the obnoxious friend can be really good. And if the doctor, somebody says, what if the doctor doesn't want you to use the tape recorder, then they're the wrong doctor. No doctor should feel uncomfortable having their visit taped, because that really it means that they're not willing to stand up for what they're saying.
And also writing down questions if you can beforehand, and even if they're general questions like, what can I do next? If you have something written down, then that can prompt you and help you remember, oh yeah, I wanted to learn about this.
We also have a question about from someone, Lisa Zion wants to know if she can help in her city town. How can she get started? There are political coffees everywhere, but breast cancer affects everyone. And we suggest starting at the Susan G. Komen group. That's certainly a possibility. You can also, as part of the Army of Women, we have troop. We'll be happy to get you more organized and through our troop organizer program. And to reach out and get more Latina women involved, and then look, we'll put some connections of some of the groups, the Latina groups we've talked about, and websites on the Army of Women website, so that you can, so that if you want to see if there's a one of those groups near you, you'll be able to find it. So I think that we've covered most of the questions that we've had. I think this has been really great. I know it's a few minutes early, but I think for our first webinar, I'm very excited. We will have the webinar on the website, so if you have people that you know, or there are people who haven't been able to log in for one reason or another, they will be able to see it later. And we welcome all your feedback on both how we can do it better, as well as how we can increase our outreach in the Latina population. So with that, thank you very much, Dr. Graves, and thank you all for joining us, and have a good day.
Thank you.